Chapter 2. Obtaining a Health History. From the beginning, there are two primary components to a health assessment. First is the health history. That's that subjective information that the patient reports about their current issues. Then there's also the physical examination, where we go in and obtain that objective information. The nurse facilitates discussion to determine the patient's beliefs. How does the patient define their current health? What are their beliefs about attaining and maintaining health? A view of responsibility for health, and their expectations. What do they expect to recover? Do they expect to be 100%? What is their what is the patient's current goals? It begins with the interview, which occurs in three phases. The first would be the introduction, where you walk in, introduce yourself to the patient, let them know your credentials, let them know what we're expecting to accomplish here today. Next would be the discussion, where we collect data, record health history, keep it patient centered. That is, the patients share their specific concerns, their own unique beliefs and values in their own words. The nurse should also facilitate, collect, and record this data in a very concise and objective way. And finally, the summary, where data collected is the foundation for the personalized and effective healthcare, allows for any clarification and a one definitive picture of the patient situation. A key component of this is going to be therapeutic communication. This is also going to be an area we're going to get very in depth with in mental health. And it's the single most important factor for successful interviewing is being able to effectively communicate with your patient. It should be professional that gains the patient's trust. Therapeutic communication can be affected by many different areas. Everything from the physical setting, the nurse behaviors, the type of questions asked, how the questions are asked, the patient's personality and behavior, how the patient is feeling at the time of the interview, and the nature of the information being discussed. When choosing a location, this should be in a quiet, comfortable area without distractions. This will be especially important for patients with sensory issues, things like hard of hearing. Removing that outside environmental noise, removing those distractions, allowing the patient to not only focus on the interview, on the discussion, but also be able to effectively process the information being exchanged. It's essential that you keep this private. This is a very sensitive issue. Healthcare is protected under HIPAA laws. It should be based on openness, honesty. Healthcare facilities are not always conducive to privacy. We should always be at least be able to draw the curtains and provide as much privacy as possible. The first impression starts with the nurse's appearance and providing a warm, professional demeanor. Interpersonal skills are also going to be key to a successful interview. Everything from utilizing active listening, showing your interest, understanding the patient's point of view, providing empathy where appropriate, communicating acceptance, treating the patient respectfully, and watching word usage. We should try to use common verbiage as much as possible. Use things like hypoglycemia for low blood instead. Use low blood sugar instead of hypoglycemia, or words like high blood pressure as opposed to hypertension. Also, consider the patient as much as possible as well. Everything from their age, their physical, mental, and emotional status. Ideally, the patient will be alert and no physical or emotional discomfort. If in distress, limit the number and nature of necessary questions. Try to space it out as much as possible. Try to provide this interview at a time where the patient's in less pain. A patient in pain is obviously not able to process and answer as effectively as they would once they've been treated. The art of obtaining information and listening carefully is an essential competency in nurses. These questions should be clearly spoken and understood. We should define words. Again, you avoid using any technical definitions or slang, only if necessary. Also, adapt the questions consistent with the patient's level of understanding and knowledge. Also, encouraging the patients to be specific, clarify their meanings, and we want to document this in the patient's own words. Some areas of questioning are sensitive, and that sensitivity can vary. You have to explain that you may have personal questions to ask, and also use techniques referred to as permission giving. Ensure your patient knows that it's safe to discuss a certain uncomfortable topic, as well as always seek clarification as much as possible. Begin with open ended questions to encourage a free flowing open response, as well as focus on questions about the patient's health. They may need to refocus questions if the patient is unable to focus on a topic or takes excessive time. Asking things like, "How have you been feeling?" Allowing the patient to elaborate and answer that in their own words. We should avoid closed ended questions as much as possible, unless we need very specific data. Do you become short of breath? Unless we want a very specific answer. For the most part, we always want to focus on those open ended questions as much as possible. Active listening concentrates on patient responses and subtleties. You should avoid formulating the next question during responses, as well as avoid making assumptions about the patient's responses. We should always, again, document that in the patient's own words. Facilitate using verbal and nonverbal phrases to encourage patients to continue talking further. And again, clarifying what is used to gather more information. Another technique to enhance data collection is going to be restatement. This is repeating what the patient says in different words to confirm that interpretation. On the other hand, reflection is repeating what the patient said and encouraging them to elaborate with more information. And finally, confrontation. This should be used very sparingly. It's used when inconsistencies are noted between the patient's report and the nurse's observation. Use tone of voice to convey confusion or possible misunderstanding. Interpretation is going to be used to share conclusions drawn from that data. The patient that may then confirm, deny, or revise. They should also provide a summary to condense and order data to clarify a sequence of events for the patient. And again, we should use simple terms as much as possible. And use because using that medical terminology may be confusing to a large swath of the population. Well, what we know what terms like cholelithiasis are. For a patient, they may only understand that as gallstones. The patient may not understand questions or may be embarrassed to request clarification, and therefore may give an inaccurate response. We should also avoid interrupting while the patient is talking, or having an authoritarian or paternalistic demeanor. Also, another key one is going to be avoiding why questions wherever possible. Asking why in a question makes the patient defensive. When answering personal questions, provide a brief, direct answer. Share experiences that support the patient and enhance the relationship or credibility. Also, an effective use of silence is going to be key. This is necessary for patients to reflect and gather the courage to address painful topics. Also, feedback that patient is not ready to discuss, that the approach needs to be evaluated. And finally, displays of emotion. Crying is a natural phenomenon and should be expected. Postpone the interview further and questioning until the patient's ready. Allow them to compose themselves. This is going to help to form that compassionate response and enhance the relationship. Anger is also going to be uncomfortable for both the patient and the nurse. Deal with it directly, though understand a lot of these patients are sick, injured, afraid, and anger is going to be a natural response to that for many people. Another issue is going to be dealing with overly talkative patients. Some people are very talkative. That anxiety while being seeking healthcare is only going to exacerbate them. These are going to be patients that are overly detailed problems that may become to the point of distraction. You should work to refocus the interview on events relative to the present situation at hand and redirect the conversation with closed ended questions that may help reduce those distractions. Other challenges to the interview would be things like the patients in the room. Maybe that patient is not comfortable discussing their current health problems with a family member or anyone they brought with them. Parent or guardians may answer for the child. Interview adolescents directly, though always have the parents present with adolescents. And for adults who are unable to answer, another person may assist. Another key area you're going to see, this comes up a lot, especially in ATI and NCLEX, is the use of interpreters. If there is any hint of a language barrier, make sure you have that interpreter available. That interpreter should be objective observer, same gender, and not a family member. And it takes time to obtain the most important data when using an interpreter. But there's going to be the key parts there. Again, any hint of a language barrier, make sure you have that interpreter available. And if they're asking you what is the most appropriate interpreter, make it the one that's the same gender or closest in age to that patient. And also, we never use a family member. This has to be a qualified healthcare interpreter. There's going to be many cultural considerations as well, as some cultures are much more open to talking about their problems than others are. Nurses are have to demonstrate communication skills between and among a wide variety of cultures. There's nowhere you're going to work in the United States that isn't going to have a wide variety of different cultural considerations. Identify any cultural factors that may influence the patient's beliefs about their health, their illness, or just their willingness to open up and communicate and accurately and truthfully discuss their problems. Going back to the types of health histories, it starts with that comprehensive health history that establishes that complete database. This is the foundation for what the rest of our treatment is going to be based on. Should a new problem arise, should a new issue arise later in care, we can then use the more problem based or health focused assessment. And finally, episodic or follow up assessments. Make sure that we're continually monitoring this patient. Some of the components of that comprehensive health history would include things like biographic data in that initial visit, their reason for seeking care, their history of present illness, the present health status, past medical histories, family histories, personal and psychosocial histories, and again, that review of all body systems in our head to toe. When identifying that history of present illness, we're looking at that chief complaint. This is that brief statement regarding the purpose of their visit, why they're here. It's going to be recorded in direct quotes from our patient. We're always going to put that in quotation marks and put that in the patient's own exact words. If they have multiple reasons, list them and prioritize. The patient may not give all reasons until they're comfortable. The patient condition, again, helps determine that next step. The urgency is required, the expediency of care that we need to provide. Data analysis to determine the cause, develop a plan. And keep in mind that biographic data and some other data may be delayed if we have a high acuity or significant issue we need to deal with right now. The present history focuses on the patient's acute or chronic conditions, current health conditions, completing that med reconciliation. This is an area we're going to talk a lot about in pharmacology here at the beginning as well. And that we want an accurate picture of every medication this patient's taking. A lot of patients are on a lot of different medications, and these medications may be written by many different prescribers. And so that we have an accurate, clear picture of exactly everything we're taking. A major method you'll see brought up is having the patient bring all the medications that they're currently taking with them. That way, we're able to get a clear, objective picture and one accurate list. We also want to identify their allergies. This is going to be a top priority, especially when it comes to prescribing medications, surgeries, identifying what allergies this patient has, so we avoid any problems that could occur later on. A past health assessment focuses again on important health history, things like childhood illnesses, previous surgeries, previous hospitalizations, any history of accidents, injuries, their immunization histories, OB history, and of course the date of their last exam. Identifying that patient's family history is going to be another key part, as many conditions tend to run in families. This is going to be a very effective method at identifying what this patient is at risk for. Are there any special screenings we should provide? We're looking at things like biologic parents, aunts, uncles, siblings, children. Identify any genetic, familial, or environmental factors that may affect the current or future health status. This is going to be a very easy method to maybe focus some of our screenings to identify those areas that patient may be at a much higher risk. When we talk about those conditions that run in families, we're talking about conditions like Alzheimer's, cancers, diabetes, coronary artery disease, including myocardial infarctions, hypertension, stroke, seizure disorders, alcoholism, endocrine diseases, and kidney disease, just to name a few. We're also going to be looking at the patient's personal status, a general statement about feelings, their family and social relationships, diet and nutrition, functional abilities, mental health, personal habits, alcohol, tobacco, illicit drug use, any environmental dangers. Are they working in a coal mine? Are they working in a factory with lots of dust, with a lot of pollutants, working around a lot of chemicals? Again, when reviewing systems, we're looking at the past and present health of each body system. We want to conduct that system analysis when the patient indicates presence of symptoms, define medical terms when necessary, providing additional health promotion data that may be collected during the review. And in a comprehensive health assessment, you're going to want to ask the most questions. This is going to be where we assess every body system. The patient may come in with one issue, but we want to conduct one head to toe, thorough, comprehensive health assessment. When completing the individual review of symptoms, we're looking at everything from general symptoms, integumentary issues, skin issues, head and neck, breasts, respiratory, cardiovascular, onto things like GI, urinary system, reproductive, musculoskeletal, and neuro. Other age related variations going to be dealing with infants, children, and that pediatric health history is going to be similar to that of an adult. Additions of prenatal care, growth and development, and behavioral status are also going to be a major focus of this. Most data is going to be obtained from the adult accompanying the child, obviously, but you should also include the child as much as possible in this assessment. The nurse determines if an adult or pediatric database format is going to be appropriate for adolescents, depending on their developmental stage and the age of that teenager. Other age related variations going to deal with things like pregnancy. Again, this is going to be a comprehensive health history is obtained. We're also going to be prioritizing things like health promotion, making sure they're taking their folic acid, iron supplements that prescribed, establishing that baseline data, and make sure that we're measuring the progress. We're getting that accurate picture so that we can monitor the progression of that pregnancy through each visit. And finally, care for the elderly. This is going to incorporate various age related questions, functional status questions. Again, the elderly may be suffering from issues with sensory issues, diminished vision, diminished hearing. They may not be able to process that information as quickly as a younger person would. It may not be necessary to collect data on things like childhood immunizations. Many older adults are going to have multiple symptoms. They're going to have multiple comorbidities, multiple conditions going on at the same time. It's just a natural part of aging. And as people live longer and longer, people are living with more and more comorbidities and compounding conditions. But anyway, that's all I got for this chapter. I'll see you in chapter 3.